majority of young people and children having mild disease, they can get sick and they can die. And so we need everyone to understand that they're not invincible. And that's not meant to scare anybody, but we do need a little bit of reality, so people understand that they can get sick. But what is even more important, that even though you're younger, you may not be part of a vulnerable group. You may live with someone who's more vulnerable. You may live with somebody who has an underlying condition, who has chronic respiratory disease, who has cancer. You may live with somebody who's over the age of 60. And if you get infected, even though you don't feel unwell, and even though you may not even have symptoms, you can pass the virus to someone else that is vulnerable, and they could get really, really sick, require hospitalization, and they could die. So it's not only about protecting yourself. We want everyone to do what they can to protect themselves, but it's also about your responsibility of protecting others. So again, it's just everything that you can do to prevent, yourself of getting in that nightclub situation, especially where there's active transmission in some countries. Avoid those crowded situations and close contact with one another to prevent the opportunity for the virus to pass. The virus likes people. The virus doesn't just waft around. It needs people to pass between. So if we give it that opportunity, it will pass between people.
And again, on that, even though younger people certainly don't have the same mortality or death rate, what's clearly becoming apparent is that a good proportion of people who develop moderate illness have long-term issues with fatigue, with exercise tolerance, with lung function and other things. And I mean, the essence here is that the virus causes the air sacs in your lung to become inflamed, but it also causes, in many cases, the blood vessels around those air sacs to become inflamed. And what you have is this really sort of inflammatory process that goes on in the air sacs and in those small blood vessels. And when that subsides, it takes a long time for your lungs to regain their normal function, and sometimes for your cardiovascular system. And that's why a lot of people are suffering long-term fatigue. They're finding it really hard to go back to the gym. They're exhausted if they're going up and down the stairs. And these are young people. Yeah. Now, we hope, and many of them are making slow recoveries, but who wants to spend 3 months or 6 months or a year recovering from an illness that lasted 10 days or 12 days that you can prevent? Yeah. We live in a society, we go to the gym, we're trying to stay fit, we're trying to make healthy choices. This is one healthy choice we can make. Yeah. Avoid getting COVID-19, because it's probably, even if you're not going to die from it, or even if you're not going to be admitted to hospital, a significant minority of people, even young people, find it hard to make a full and immediate recovery from the disease.
Can I just say that many people have reached out to me personally on Twitter and on other social media means about groups that are in that recovery phase. I just want to say that we hear you. We do hear you. We do have a group that's looking at the longer term recovery of people who have quote unquote recovered. The people that you're talking about that are dealing with these long-term effects. We hear you. And what we're trying to really understand is, even though we're 7 months in, I know it feels like an eternity for most people. It's still very, very new, and there's still a lot that we're learning. But particularly those who have recovered but still have these lingering effects, we're trying to better understand what that means, and we're trying to better study this so that we can give you the support that you need. So I just wanted to give a shout out to the groups that have contacted me to say, we do hear you and we are listening.
Thank you very much for receiving a lot of questions, so I'll try to summarize maybe 2 more. One is coming from Facebook from Cecilia Vichis. How effective is contact tracing and how often should one get tested? You mentioned that we need to know where the virus is in community to control it, so I thought it's good to clarify contact tracing and testing.
Yeah, so contact tracing is essential. In infectious diseases, what everyone needs to understand is that the virus passes between people. And so when we know where the virus is, you think of, I wish I had a little visual right now, think of these dots, think of these dots representing people. If someone has contact with lots of dots, then you can spread the virus between people. So what contact tracing does is it identifies a case, and testing is essential to be able to determine who has the virus and who doesn't have the virus. And then you find all of the people that they came in contact with, 2 days before they develop symptoms, up to 14 days after they develop symptoms. You find those contacts, and then you follow them. You put them in quarantine, which means you separate them from others so that if they have the virus or develop the disease, that they don't pass it to others. And you follow them for 14 days. If we do that for every case, if we do that well, for even most cases, we will be able to stop transmission between people. It's incredibly effective, but I have to say it's incredibly difficult. But it is possible, and there are so many people now that are trained to do contact tracing. And one of the things I'm really encouraged by are many countries, high income, low income, north, south, east, west, rural, urban, that are building up this workforce of contact tracers, which are people who are what we call these shoe leather epidemiologists, which basically means people on the ground who are helping to find all those contacts, support those contacts through the quarantine period, and making sure that we break these chains of transmission. Maybe you want to...
No, I think that's pretty good. On the testing thing, and sometimes we get a bit distracted by the whole testing, number of people we test. It's not so much about the absolute number of people that are tested. It's really about who is tested. We really have to focus on testing suspected cases first. Just because you're having a test every 3 days when you're well doesn't necessarily mean anything. What we really need to do is focus and prioritize testing for those who need testing. And that is people who are developing the illness or unwell, or people who are contacts who develop a fever. The more important issue in this is how efficient is the testing process. Are we testing people quickly? Are we turning the results around quickly so it makes a difference? Little point having a test if I have the test today and I get the results in 10 days' time, because by that point I'll have spread the disease to another group and they'll have spread it to somebody else. So it's about the speed and efficiency of testing, and it's about the percentage positive. When we hear people talk about this, I much more look at, if we take my own country, Ireland, only 1/4% of people tested are positive as of yesterday. That means a very small proportion of people are testing positive, which means you're having to test many people to find a positive case, which means you're almost over testing, but it means you're not missing anything. There are other places in which the testing positivity rate is 40%.
Yeah.
Somewhere like Afghanistan right now, it's 40%, which means 4 out of 10 people tested, 40 out of 100 tested are positive, which means we're missing lots and lots and lots of cases. So when you look critically at testing, don't just look at the number of people tested in your country by day. Look at how fast is the testing done, how quickly are the results available, what is the proportion of, and you have to be your own critics. You have to look at the system and you need to ask those questions, because testing is important, but it's only as important as it contributes to contact tracing, it contributes to our knowledge. The Director General, Dr. Tedros, has said it many times. You can't fight a virus blindfolded. And not having testing is like fighting a virus blindfolded. If you don't know where the enemy is, if you don't know where your enemy lies, then you're going to be a victim of that. So I think that's the importance of testing, but testing within the context of surveillance.
Can we just say to the viewers that there's 2 things that are really important that you know of what to do. If you're feeling unwell, even a little bit unwell, stay home. Contact the hotline, contact your medical provider, and find out what are your next steps. Because it is important, even when you're feeling unwell, some may have underlying conditions, some may have other, contact your medical provider and find out, what should I do? Should I get a test? Can I get a test? If you think you are a contact of a known case, stay home. Again, contact the hotline, contact your medical provider, say, I think I'm a contact, what should I do? Find out more information. And I think people need to really understand that there's things that you can do yourself. The contact tracing system and the testing system and surveillance systems in place in countries are working. Some are working better than others. They're not 100%. So you as an individual need to know that there are things that you can do as well. If you are concerned and you can stay home, contact that hotline, contact your medical provider, say, what do I do next? I think I may have been in contact with someone who is a case. If you are not contacted by the contact tracing system, just find out what you can do. Just be informed, be vigilant, be informed, know where this virus is in your community.
Thank you very much. We received a lot of questions from parents of young children, how to protect their babies, or if their kids go to kindergarten or to schools, should they wear masks? So if we can give some advice for parents of young children before we close.
So I'm a parent of my husband and I. We have 2 kids. We have a 9-year-old and we have an 18-month-old. So the way that we keep our children safe is ensuring that we teach them the basics in hygiene, making sure that there's hand washing or alcohol-based rub. Even the baby, we do the alcohol-based rub when we go out. We actually keep our outings quite minimal. You know, if we need to go out, we go out. If we don't, we are very fortunate to have a nice home that we can stay in, we can play in, and we keep them home. My son's school was open for a while. It was closed for a while, then it was open for a while. But again, when he went to school, make sure that he follows the rules at the school and keep the physical distancing and the rules that they have in place. They wash their hands, I don't know how many times per day. He said, Mom, I think my hands, you know, I said, this is good. And again, it's about habit. It's about habits forming. And especially with young kids, they're actually quite compliant. Babies, it's a little bit more difficult. But there are a lot of systems that are put in place in creches and in schools to protect children. But it's important to talk to your kids. I think one of the most important things that parents can do, and I know we're all doing our best with this, and I know it's really, really hard, and how much we really appreciate teachers and you know, in teaching our children, but talk to your kids. This is really scary for many of them, and it's really confusing. This is a virus that you can't see, you can't smell, you can't touch, and so it's very confusing for them. Talk to them, listen to their fears, do the best you can at answering their questions. If you don't have the answers to those questions yourself as a parent, try to find out where you can get more information. I know my 9-year-old is incredibly clever and smart and asks probably the toughest questions I've received, and I don't know how many press conferences we have had, but really tough questions. And so I would just encourage you to try to talk with them. And if they're scared and if they're fearful, acknowledge that, you know, it's okay to be scared, but let's turn that into something positive. My son drew rainbows for everybody here. Turn it into
mine.
I have mine.
You have your line as well. So, you know, turn it into something positive. And I know a lot of kids clap for health workers, and so they can be a part of this too. So whatever we can do to kind of engage them and make sure that they feel part of this. But just to say, we do acknowledge that this is scary, and we will get through this.
Thank you very much. Mike, for the end, do we have any positive signs from science on vaccines and treatments? We received a lot of questions on this issue.
Yes, we'll probably have to do a whole other session on that because there is that much positive news. I think increasingly we're seeing more vaccines move into what we call phase 3 trials, which are real world trials. That means when we give the vaccine to people in the community and we see if it protects them from the virus that's spreading in their communities. Those studies are just getting underway. What's positive, I think, is that of the 4 or 5 of those going through now, none have failed so far. So pretty much all of the vaccines that have in the platform that have come through phase 1 and 2 trials have all made the grade in terms of safety and in their ability to generate immune response. So we're not seeing a lot, because very often in vaccine development you lose 1 or 2 along the way and you're hoping to keep a number of candidates right through to the end. So we're making good progress. We're not losing candidates right now. The real world trials are very different, and we really thank those people out there. Particularly, again, it's mainly 18 to 55-year-olds who are volunteering for the studies, because they're hugely important studies, and people are stepping forward and saying, yes, I want to be part of this study. And that's a massive contribution to the whole world. People who are doing that for drug trials, they're doing that for vaccine studies. It's a huge gift to humanity to participate in research. You don't have to be an observer. You can participate in this, get involved. And we're working with many partners now to expand the trials around the world, and also to expand access to those vaccines. There's a lot of work going on, not only to ensure that we get an effective and safe vaccine, but also we can scale up its production. And there's a lot of work going on that, and we can allocate and give vaccines to everyone in the world who needs them. And that's a big fight, is to make sure that we are fair, because it's not just science is important, but fairness is just as important. And we need to be fair about this, because this is a global good. Vaccines for this pandemic are not for the wealthy, they're not for the poor, they're for everybody. So WHO is a very important job to make sure that we're fair. And we're working just as hard on that as we are on the vaccines. On the drug side as well, we've seen some positive results from some drugs. We're adding more drugs into our Solidarity trials. There are some interesting and hopeful signs with things like hyperimmune globulin, and potentially down the line with monoclonal antibodies, again based on material on blood that's taken from recovered patients. So again, patients in recovery are contributing and benefiting people who are coming behind them in the system. So I think we are seeing hopeful signs, but I think we have to be realistic on two things. One, we need to be realistic on time. Realistically, vaccines, no matter how fast we push, we have to make sure these vaccines are safe and that they're effective. And that takes its own time. And we're speeding that up as much as possible. We're not in any way going to cut corners on safety. We have to be able to look ourselves in the eyes, and we have to be able to look at our communities and ensure them that we have taken every precaution to make sure these vaccines are safe and effective before we go giving them to general populations. In order to make that happen, we can shorten that time, but realistically it's going to be the first part of next year before we start seeing people getting vaccinated. That's the first sort of issue. Second issue is vaccines are never 100% effective. They generate immunity in most people. For some vaccines, it's only some people. For some vaccines, like measles, they're highly effective and 95% of people are protected. We don't know where we are with this. So we're going to have to wait and see how effective the vaccine is going to be and how long will the protection last. So the idea that we're going to have a vaccine in 2 or 3 months and then all of a sudden this virus is going to go away, I would love to be here saying that to you, but that's just not realistic. And it's really important that we're realistic in our expectations. We have to push and get the best vaccines we can, get the best treatments we can, but we also need to be realistic and we need to do what we can now. And Maria said it, there's so much we can do now. And it'll be so much easier to get rid of this virus using vaccine if we've already suppressed it. Because it's easier to beat an opponent when you've already exhausted your opponent, and we need to exhaust this virus. We need to push the virus out of our communities, and then using vaccine will be much easier for us to be effective in the use of that vaccine. So we need to work as hard as we can now to continue the fight against the virus, work as hard as we can to develop the vaccines, and then bring the two together to finish this thing off, I hope.
I thank you very much. I thank all our viewers from all parts of the world. I'm not going to list the countries. It's a long list.
Oh, good.
I thank Mike and Maria, and please watch us next week. We'll inform you about the time. Thank you very much and have a good day. And stay safe.